As a skilled speech-language pathologist with over 25 years of experience working with adults with cognitive deficits in virtually every setting, I came to the conclusion, backed by popular consensus and various research studies, that all I can do for dementia is assess, stage, and educate patients and their caregivers. For me, this has not been enough. The incidence and prevalence of dementia is on the rise, and our reimbursements for treatment of these populations are dwindling. The lack of substantiated therapy approaches and assessment protocols has devalued our discipline and provides justification for limiting reimbursement for this type of therapy. Occupational therapists who treat cognitive deficits are faced with the same limitations, and this leaves a lot of patients and families dismayed and confused and nowhere to turn. I researched treatment options in the fields of speech pathology and occupational therapy, but came up short in finding functional cognitive approaches that presented an opportunity to demonstrate real improvement in functional progress. The hallmark of justified reimbursement, of course. There was a lack of evidence that proves we are invaluable and indispensable in our patients' rehab process. But in my search, a recurrent theme became evident. The importance of routine was a concept that almost all of the literature about dementia embraced. My continued research led me to uncover the elements of routine that play such an important role in the lives of our patients and their families. I completed an ex post facto research study that pointed to neuropsychology and neurobiology studies analyzing routine and habit. This led to the conclusion that not only is a current routine important in maintaining function in the home, new tasks can be incorporated into the routine to establish, maintain, and maximize function in our patients' daily lives. Routine taps into procedural memory that enlists the motor memory centers and can aid in the performance of daily tasks when declarative memory fails. This process has been proven time and time again in my own practice, and I needed to share it with you. The What's Next program was born from this research. The What's Next patent pending program gives cognitively impaired patients with mild to moderate severity and their families an alternative to the cookie-cutter assessments and treatment strategies popular today. It provides the clinician with a protocol to teach patients to integrate new important tasks to help keep them as independent as possible in their home. The program focuses on 6 essential skills that have been determined to play an important role in an individual's ability to maintain independence: time management and orientation, medication management, follow-through with home exercise programs, nutrition and hydration management, phone use, and emergency response. What's Next includes an assessment protocol that's simple and easy to administer, which tests what we are teaching, and therefore real progress can be measured. It helps relieve the burden that caregivers experience when responsible for caring for their loved ones. Cognitive communication assessments commonly used in our field have been disadvantageous, as they do not measure what we teach, lead to functional goals, or measure functional progress. Alternately, the assessment developed for the What's Next program leads to measurably improved outcomes. What's Next teaches the SLP or OT to be able to identify appropriate candidates, assess cognitive function in 6 important areas, easily enables the clinician to document progress, helps the clinician to set goals based on a routine-based program, and teaches the treatment strategies to help improve the use of new routines. This program provides the clinician with all they need to be successful. Included with What's Next are PDFs for record keeping, a decision tree to help with the inter-rater reliability of the assessment, and a worksheet to identify goals. The What's Next program teaches the clinician about the development and research substantiating this protocol so they can effectively communicate the rationale for its use. The entire program is demonstrated through simulated clinician-patient assessment and treatment scenarios. Case studies are utilized so the clinician can practice candidate selection, assessment, and administration of the protocol. This program and all the materials that are needed to perform What's Next will be provided for the clinician's use and reuse. The clinician will also attain AOTA or ASHA-approved CEUs through Northern Speech Services. It's time to provide cognitively impaired patients with appropriate, measurable, and effective therapy. What's Next can help therapists and the agencies they work for stand out in this arena, maximizing reimbursement for therapy and ultimately improving patient outcomes, which is sorely needed in this population. As a clinician, this is the best gift you can give to yourself and your patients. As a decision maker in your agency, responsible for the quality of care for clients with dementia in home health, assisted and independent living facilities, you can arm your clinicians with a revolutionary new treatment approach that really works and boost your client satisfaction scores significantly. Currently, individual and group rates are available for certification, and support does not stop after receiving certification. We look forward to seeing each and every one of you in our after certification peer support group. What's Next is available through a partnership of Speech and Cognition Specialists, LLC, and Northern Speech Services. For our cognitively impaired patients, What's Next is the next step toward independence.